common food allergy that you're going to see in a young infant. Milk is more commonly seen. And it didn't discuss other risk factors such as siblings of peanut allergic children. So these were the guidelines that came out, again, stratified into 3 different recommendations. Severe eczema or egg allergy, again, based on the LEAP study. Consider testing with a peanut IgE serum test, and the serum testing is in there because we had pediatricians and dermatologists on the panel, and they wanted some way to be able to test the patients and not have to come to an allergist, and or skin testing, and based on those results, I'll show you what to do as far as introducing at home, in the office, or doing a food challenge. In the earliest age, they really recommended doing this around 4 to 6 months, and there's some controversy over this, is what I'll show you as well. Mild to moderate eczema was the second category, and introduced around 6 months, and then no eczema or no food allergy, basically introduced when it's age appropriate in accordance with family preferences and practices. Again, I think you have 3 different messages that a primary care provider has to talk about or has to think about, and there are much simpler ways to do this, I think. And again, we're not seeing those patients at 2, 4, and 6 months. It's the primary care provider, so we need an easy message for them to get this out to their patients, and I think this was a bit confusing. But if you look at now what to do with these patients, most of the patients, about 87% of infants in the US are going to be having no eczema or food allergy and introduced freely at home. Mild to moderate eczema, about 12% introduced at home. In the severe category, again, with egg allergy, about 1% of all infants. If you have a positive serum-specific IgE, then you're sending patients to be evaluated further by a specialist, by an allergist. Undetectable, then there's low risk of reaction, you can introduce at home. 0 to 2 millimeters was again considered negative in this guidelines, and that lower risk, so you can introduce at home. The other part here is that you could do a supervised in-office feeding, which most pediatricians are not going to have the time and space to do that.